Bismillahirrahmanirrahim. Dear students, I welcome you on this online class, and today's topic is angina and anti-anginal drugs, which we already have covered a bit, and this lecture is intended for Doctor of Pharmacy, second prof, Pharmacology and Therapeutics 1. Well, what we have already covered about angina as a disease, about its definition, its pathophysiology, and what does it mean, how the patient will feel, then its physiology, pathophysiology, its different types, it's all these we have already discussed. Types of angina pectoris we have discussed in class. Then the classification. The last topic we covered was a classification of the drugs for the treatment of angina. If you remember, I hope so. There were these are the drugs that are used to treat. I'm going to repeat that again. These are the drugs that are used to treat angina pectoris. Among those, the nitrates have the nitroglycerin, glyceryl trinitrate, isosorbide mononitrate, and these are the brand names that are available in the market. These are the non-proprietary name of these drugs. Nitrites, inorganic nitrites is sodium nitrite, and organic nitrite is amyl nitrite and ethyl nitrite. Then we have another class of drugs that is used to treat angina pectoris, that is calcium channel blockers. Among the calcium channel blockers, we have dihydropyridines as one of the drugs include nifedipine, nicardipine, amlodipine, felodipine, and nimodipine. These are the drugs that these drugs are available with these brand names. Adalat from Bayer. This is Cardon, Norvasc from Pfizer, Plendil, and Nemotop. Other calcium channel blockers that may be used for angina pectoris is diltiazem, available as Dilzim, Bapredil as Vescor, and Verapamil as Kelan from Cert. Then we have beta blockers. We have Inderol, the non-proprietary name. It's a very famous drug. The non-proprietary name for Inderol is propranolol. Then etinolol. Etinolol is a cardioselective, that is tenormin, and esmolol available as Esmo. So propranolol is a non-selective beta blocker, while etinolol is a selective beta blocker. So this chart actually where the drugs will act and what effect they will produce to relieve angina. So basically what we have discussed already is angina pectoris occurs between imbalance of oxygen demand and oxygen supply. All the drugs that either decreases the oxygen demand by the myocardial tissue, or the drugs that increase oxygen supply to the myocardial tissue, so thereby correcting the balance. If the balance is corrected, then the goal is achieved. Angina will be relieved, not cured, remember. But if oxygen demand is greater than the oxygen supply, then ischemia occur, and this will cause angina pectoris here in this block. So the drugs we just discussed a few minutes before will either decrease oxygen demand by the myocardium or will increase oxygen supply. So what are the drugs? Beta adrenergic antagonists or beta blockers and calcium channel blockers. Calcium channel blockers that act on heart will cause heart will drop, or beta blockers, the heart rate will decrease the heart rate and contractility. Contractility is a force of contraction. So greater force required by the heart to contract, greater oxygen demand would be there. So heart rate, if heart rate is increased to many folds, for example, if heart rate is 110, it requires more oxygen by the myocardium to work more efficiently. But if heart rate is like 60 to 70, then the oxygen demand would be different. So beta antagonists and beta adrenergic antagonists and calcium channel blockers will actually cause decrease in oxygen demand by decreasing heart rate and contractility, the force of contraction. Then organic nitrates and some calcium entry blockers will decrease preload and afterload. And if you remember, what is preload and what is afterload? So a preload and afterload will be decreased by organic nitrates. So if you remember, what is preload and what is afterload? Then oxygen supply, we have coronary blood flow and a regional myocardial blood flow. So we are concerned with this. Vasodilators, especially calcium entry blockers, will increase coronary blood flow, so thereby meet the demand, thereby try to meet the demand of the myocardium and relieve the ischemia, so thereby maintaining the balance and ultimately relieving the angina. So if we discuss the pharmacology of nitrates and nitrites, so the first drug in this group is nitroglycerin. So nitroglycerin was originally identified as an explosive, but the systemic drug is not explosive. So mode of action. So mode of action involves the first thing in this mechanism of action of the nitrates. It should be bioactivated. Bioactivated means it's a prodrug. It needs an enzymatic reaction for its denitrification to release nitric oxide. So we will see that what is the importance of nitric oxide. So what enzymes are involved in its bioactivation? If you remember by our discussion from our discussion back in metabolism, drug metabolism, we discussed 4 purposes of drug metabolism. Amongst those 4, one was bioactivation of prodrugs. Without bioactivation, many drugs cannot act. So the nitroglycerin or nitrates or nitrites are among those, because they have to release nitric oxide. So which enzymes are involved in denitrification? Glutathione S transferase in smooth muscles and other cells. And other enzymes that play important role in bioactivation are aldehyde dehydrogenase, isoform 2 and 3. So there are basically 3 enzymes that are involved in bioactivation. Number 1, glutathione S transferase. Number 2, aldehyde dehydrogenase isoform 2 and 3. So free nitrite ion is released and converted to SO2. So here, if we see so here, this is the capillary endothelium. Here, select the pen color. So it is this is the natural process. What happens in our capillary endothelium, in the blood vessels, this is a normal reaction. Arginine is converted into nitric oxide, and nitric oxide is ultimately a relaxation factor. This is transported here, the nitric oxide. So nitric oxide causes vascular smooth muscles relaxation. So this is the main compound we have. Either we get naturally, or if something goes wrong or we need vasodilation, here we give the drugs nitrates. So these nitrates will actually cause are denitrified. So the denitrification, nitrates are uptaken here in the smooth muscles, and the denitrification occurs by glutathione S transferase. Then what happens? It is denitrification, the nitrate ion is removed and it combined with the oxygen and makes a nitric oxide. So nitric oxide acts on an enzyme that is present here, known as guanylyl cyclase. The star shows that it is present in inactive form, and here this inactive form is converted into active form, which converts the GTP, guanylyl triphosphate, into cyclic GMP. Cyclic GMP actually causes the dephosphorylation of myosin light chain. Myosin light chain, if phosphorylation occurs here, so this will cause dephosphorylation and ultimately this will cause relaxation. So if the phosphorylation of myosin light chain occurs, then it will cause contraction, which is already there. This is the mechanism of action. So what are the pharmacological actions? Pharmacological actions are on the vascular smooth muscles. It causes marked relaxation of veins, increased venous capacitance. What is meant by venous capacitance? It increases the capacity of the veins, caliber of the, because it causes the relaxation of the veins, so it increases the capacity of the veins to hold more blood. So epicardial means the coronary arteries that are present on the the cardiac tissue are dilated, decreased arterial pressure and decreased contractility. So ultimately these will cause relaxation in myocardium and oxygen demand will be reduced. There are certain indirect effects of these nitrates as well. These evoke baroreceptors and hormonal mechanisms in response to decreased arterial pressure, so thereby ultimately increasing a bit of arterial pressure. So, how does this affect? All these pharmacological effects are translated in the relief of angina. So effects of the effects on myocardial oxygen requirements. So we just saw that what happens. Marked relaxation of veins, increased venous capacitance. So I just told you that venous capacitance means the ability of the veins to hold more blood increases. So this increasing venous capacitance with nitrates decreases a venous return to the heart, decreases ventricular and diastolic volume. So what happens is, when more blood is retained within the veins, so less amount of blood will come into the heart, back into the heart. So thereby this will decrease end diastolic volume. So EDV or end diastolic volume refers to the volume that is the final volume just before the contraction of the heart starts, when the diastolic phase is ending. So this defines the preload. So greater that volume, greater would be the pressure for in the heart to pump that blood. So thereby all these measures will decrease oxygen consumption. So decreasing peripheral arteriolar resistance, it reduces afterload and thus myocardial work and oxygen consumption. So it also increases perfusion pressure. So other effects, nitrite ion reacts with hemoglobin, which contains ferrocyan, to form methemoglobin, which contains ferric ion. So ultimately, if that nitrite ion, if overdose or there is an excessive nitrite ion or denitrification of nitrates occur, excessive nitrite ion is there which will react with hemoglobin. So it will form methemoglobin, which contains ferric ion. So ferric ion has a poor affinity to bind with oxygen or methemoglobin. So larger doses of nitrites can result in pseudocyanosis, tissue hypoxia, and may cause death. So in a nutshell, this is the mechanism of relief of anginal symptoms. The nitrate-induced relief of anginal pain has been ascribed to decreased venous return, which results in decreased intracardiac volume. The volume in the heart will decrease, the volume of the blood, due to increased venous capacitance and decreased venous return. Number 2, decrease in cardiac work secondary to the fall in systemic arterial pressure. So blood pressure will also decrease because of relaxed vessels. So if the vessels are relaxed, so heart has to push less blood. Decreased intraventricular pressure and left ventricular volume results in decreased wall tension. So because there is a less amount of blood in the heart, so ultimately left ventricle will have to pump lesser amount of the blood, which will decrease the wall tension. So dilation of epicardial coronary arteries, which will increase the blood supply. So here you can see the doses. Short acting nitroglycerine, this is sublingual. isosorbide dinitrate sublingual. These are the doses of all these. These are short acting and these are long acting. Long acting means these can act for hours, while short acting act within minutes, and these are mostly used in emergency condition. Therapeutic uses of nitrates and nitrites are angina pectoris. Therapeutic uses denote to those uses of the drug in which diseases the drugs are used. So angina pectoris, congestive heart failure, acute myocardial infarction, and cyanide poisoning. Side effects. Acute side effects means immediately after the administration. Postural hypotension, tachycardia, and throbbing headache due to accumulation of blood in the vessels. Tolerance. Repeated exposure can result in tolerance. Diminish release of nitric oxide. Intolerance, the effect will not be shown. Thank you very much for your patience.